Hello again, I'm Joel Barthelemy. I've often said it's our healthcare delivery system that is broken and needs reform. You only have to look at what is happening in rural parts of some states to see what I mean. Since 2013, 26 hospitals in outlying areas have had to close down in the U.S. Of course, the closures mean that residents of the affected areas now have to drive miles away for health care, especially emergency medical care. Since the hospitals are often the largest employers in these smaller communities, the local economies also take a tremendous hit in the loss of jobs and revenue. When Congress approved the Affordable Care Act, the assumption was that states would accept an expansion of Medicaid. But 23 states have refused because the federal funding ends in 2016, meaning they would have to foot a larger Medicaid bill from that point on. As a result, there will be a reduction in the Medicaid money that many of the small hospitals in these states depend on. The governor of the state of Georgia suggests that the struggling hospitals in his state could offer fewer inpatient services and still keep their hospital licenses by converting to freestanding emergency departments. Even offer newborn labor and delivery services. But if they are no longer classified as hospitals at the federal level, they would lose the ability to bill Medicare or Medicaid for facility fees. Some would argue that urgent care centers could pick up the healthcare slack in these small communities, but urgent cares have to be profitable as well. And they often cherry-pick their locations based on socioeconomics and insurance rates of residents. Could a hybrid of sorts be the answer? Why not mix lower-level emergency care with primary care services? The poster child for this idea is Anson Community Hospital in Wadesboro, North Carolina. Carolina's healthcare system cut the hospital's inpatient capacity in half 2 years ago, from 30 beds to just 15. Anson's major innovation? It uses a patient-centered medical home model, offering residents access to primary care providers with the help of a patient navigator. But it takes money to make this kind of transformation. Carolina's healthcare system spent $20 million on the Anson Hospital before it reopened in July to begin its new operations. I would make another suggestion. Find a way to connect these struggling hospitals with specialists in urban areas via telemedicine. The investment in connected health equipment would be a very small fraction of the renovation costs. While increasing healthcare access, a connected health system would make it more convenient for area residents, building into primary care the ability to reach specialists in a more timely manner would help improve outcomes and result in lower overall costs. A byproduct is what happens to the local economy. We've seen it in other locations that when there is value in the local hospital, businesses begin to view the community as a place to locate, and they bring in jobs. All of this coincides with our vision here at Global Med. Provide quality health care to all. I know we can because we're already doing it in our country and in dozens of other countries. I'm Joel Barthelemy.